now for 10 years plus, Jamal and I have been running this course twice a year, once in London, once in Manchester, with the objective primarily of teaching sinus augmentation in all its glory.
It's really gratifying to see that that course developed into something national, and it's now recognised as the benchmark course in maxillary sinus grafting, bone grafting and reconstructive dentistry.
If you're going to be lifting the sinus membrane to put the implant behind it, well, why not just do a conventional lift? We know that it works.
I think it's really useful for the delegates because they start off their training working in that limited field around the maxillary alveolus, and they might not appreciate the anatomy that's above there or all the possible things that can go wrong afterwards. So we try to present a really wide range of complications related to sinus lift and implant placements, and also help delegates understand how we can assist them to manage them.
We come from the other side, if you like, from the sinuses, and traditionally, if you like, in medical schools, and each one tends to stick to their own area, and we very rarely go into other people's regions. But now that there is that crossover, it's very important for them to know that where they are working is very close to the area where the sinuses are. So it's important for them to know what is their number one, and what can be the problems in that area, and what to try and avoid.
My colleagues in Glasgow do sinus lifts, and I felt that I was having to pass patients on over to them rather than do them myself. And I'd already possibly got a good relationship with the patient, and felt that it was disappointing for them if I couldn't continue the treatment and do the whole lot.
I just wanted to find a course that would give me as much confidence to carry out lateral sinus lifts, basically, to give me the confidence to deal with complications and to actually learn from ENT surgeons and people that have been doing it for years.
We also employ the help of our ENT colleagues, who give us this extra dimension of what the ENT surgeons experience in terms of sinus disease and sinus pathology. And it also allows dentists not only to learn a technique, but also know when to apply it and which patients they need to look out for.
By my algorithm, I usually ask them, have you got a blocked nose, does it run, have you got a headache, and have you lost a sense of smell? If they answer yes to any of those, they've probably got a problem up their nose.
One of the incentives for booking on this course was the hands-on, and to see some live surgery and to do some surgery, and I suppose that's the most realistic thing we can get.
The cadaver heads are fresh frozen, which means that when they're thawed, they're very similar to the consistency that you actually get in humans. So the membrane anatomy is maintained, and the texture of the soft tissues is maintained. The advantage of this, of course, is that you're practicing on something that is pretty much representative of what you're going to encounter. And in fact, if anything, the cadavers are slightly more difficult to operate on. So if you do a good job on the cadaver, you're probably going to do a good job on the patient.
Doesn't matter how much talking you get given, it's the nitty-gritty hands-on stuff that you need to do.
If you're going to do surgery on somebody, make it count. Don't do fiddly bits of surgery. Go in, do the surgery, rebuild everything, and make it count for the future.